questions, but I'd love to talk about scalp health. I'd love to talk about RIVE as well, because we just showcased the most incredible result that I had in the clinic. Tell us a little bit about RIVE, and then finally the new launches.
Sure, absolutely. So we've really created an entire RIVE hair restoration system. When we first launched the RIVE, it was just the in-office treatment and then a topical take-home for the patients. We saw incredible results with it, whether it's been utilized with like the Aquaferm and driving in with the ultrasound.
Patients love that.
It's a great procedure.
Yes.
You're able to hyper concentrate that dose right at the follicle level. With the ultrasound handpiece on that Aquaferm. It's designed specifically for that. It's designed to actually lower the Dalton weight of the serum.
Yes.
And then hyper concentrate. Now it's transdermal itself. The serum is.
It is. It just goes in.
It'll go right in. But the reason the ultrasound's really nice is because you can have a transdermal product that will absorb the entire dermal architecture, or you can use the ultrasound to actually push it all to a certain level right where that follicle root lives. So
that's where it needs to be.
That's exactly where it needs to be, and that's why we see such robust response in as little as 3 weeks sometimes. Because you're to do anti-inflammation. We gotta address angiogenesis, which RIVE does as well.
It does.
You have to address structural change, so collagen and cytokeratin 15 as well.
We talked about that.
Then you also have to talk about signaling. So you want to stimulate the anagen phase of hair growth, which RIVE works as well.
Yes.
And then that fifth phase, or the fifth kind of pillar, is scalp health. Scalp health. So nutrients. Obviously we want to talk about nutrients, within the body, or scalp nutrients as well. And we're talking, in continuing the signaling, which we needed to kind of bring that signaling full circle, and we've launched now the RIVE Cellular Shampoo and Conditioner. So
Coming to you, Beaconsfield.
This is the world's first and only fully cellular shampoo. So you're able to continue and support the signaling while providing nutrition to the scalp as well, instead of stripping all the nutrients from the hair.
Yes.
Like most of our shampoos do. We're able to really utilize a shampoo that really does have a nice lather to it and does have any of the, the phthalates or sulfates in there that cause damage to the follicle and the hair itself. But it's a nutrient providing shampoo, and then it's a spray leave-in conditioner, again, to kind of really just protect and coat the hair at that point.
So with the conditioner, can I just spray it, leave it on, and go out?
You can.
You can.
Yeah, you can.
I'm not going to look greasy. I'm not going to look wet.
No, so
acceptable.
Very much so. So a lot of our offices, a lot of the women, some of the men use it differently than the women. Some of the men will put it on wet hair and use it, and then they can kind of just leave it in there.
Yeah.
A lot of the women will put it in and utilize it. It's even a great detangler, actually. So, but they'll utilize it well.
Ladies.
And then they'll dry. You want to put it on. You can put it on wet or dry, but a lot of them will dry their hair and then style, and it's perfectly fine.
Yes.
So
I think this is fascinating because RIVE has been very successful, and in a lot of our patients going through menopausal changes, we know that the estrogen testosterone ratio is changing.
For sure.
Testosterone becomes DHT. DHT attacks the hair follicles, and this is really where the problem lies. So we really should be starting to look after our scalp health as early as we possibly can. And RIVE has been so easy to use. Super easy.
I'm glad you've had the success with it, and we're seeing the same thing here in the United States. It's hair loss is almost becoming a pandemic.
I say the same thing.
We've seen 1 in 4 Americans now are suffering from hair loss, and it's not, we've seen it post-COVID hair loss. We've seen it more autoimmune disorders picking up. That's a hair loss problem usually as well.
Yes.
But we're also seeing it with kind of the weight loss surge that we've seen as well.
Correct.
If you're on a weight loss peptide, rapid weight loss, weight loss peptides are causing hair loss. When you lose weight rapidly, it can be healthy for the body in some sense, but also stresses the body, which will cause hair follicle loss. The same way, postpartum can do as well. So we've seen such an increase in it. So there is really a huge need for scalp health, and it really does start with the scalp. We can do a lot of things, and we can take nutraceuticals, we can do all those things, but it's kind of like the scalp is like a soil.
Yeah.
If I'm going to plant seeds, I'm going to really need to fortify that soil to get a much higher yield. And that's what our whole system does. You're fortifying the soil to produce a higher yield. And it's a complex problem, so it creates a complex solution. We have that with the whole RIVE system now.
Perfect. I congratulate you for that. It makes total sense for me. And you are absolutely right. Our patients are presenting very differently in the last 4 years. I'm certainly seeing a lot more thyroid issues.
For sure.
Certainly see a lot more immune changes in our patients. And it's great that we have your full consortia, if I may say, of products within the scalp health system that I'm excited to bring to Buckinghamshire.
For sure.